this is your second stint at Fortis. What has changed? I mean, has there been a shift in strategy? How do you see it?
It's it's really interesting, the Indian healthcare environment. I've told people this often that it's a bit like watching a Hindi movie. Sometimes you step out for half an hour, 45 minutes, come back, you really haven't missed a whole heck of a lot, and not that much has changed. So while India continues to change, continues to evolve, I think a few things have changed. One is that the awareness level and the education from a patient or attendant perspective is substantially higher than used to be, and that's obviously driven by the web, the internet information that's available. So people are very much, people rarely go to a doctor not having any clue what's wrong. They've done their research, and generally in India today, our communities are well educated. They want to understand what's going on, and they try to find out what's happening. So I think as a patient, as a attendant, I think people are far more aware in terms of what's happening. The second thing is that our brand is developing. I think 6-7 years ago in my first round here, Fortis was primarily a northern brand that had strong presence here. But subsequent to that, we've grown. After the acquisition of Wockhardt, we have a strong presence in Bombay, we have a strong presence in Bangalore, and we continue to expand. We have a strong presence in Calcutta as well. So I think now we are a national chain. I think we're one of only 2 national chains, so I think the brand is significantly stronger as well. And I think the most important piece is that from a clinical perspective, I would put Indian healthcare, and having spent a good portion of my life abroad, I would tell you that I think Indian healthcare and our doctors are as good, if not better, than just about any place in the world. So I think lots of stuff is happening. We still have work to do on the PPO perspective, on the government public-private partnership perspective. I think we still have some opportunities there. I don't think that we've moved the needle enough there. I think we still have to figure out how to improve access. I think we've all done a little bit. Certainly we need to do there. So I think while some things haven't changed a whole heck of a lot, some things have changed a lot. And I think we'll continue to see more of that as we go forward.
As a sector, do you think it is like still booming, still showing a tremendous growth of rate, or is it in a consolidation phase?
You know, the good news, bad news there is that, so the answer is, from a organization company perspective, it is growing. It is growing, it's going to continue to grow. The bad news is that we are in the business of healing, and that comes at the expense of people's health. Unfortunately, the disease burden in our country continues to grow. So we are still dealing with things like dengue, which you would think that, collectively, the private sector, the public sector, that we'd figure out how to eradicate something like that. But we just dealt with a terrible, terrible strain of chikungunya in the past 4 or 5 months, and that's been challenging as well. Cancer, India is diagnosing 1.5 million new cancer patients every year. We continue to be the diabetes capital of the world. I heard a very sobering statistic the other day about cardiac disease, that in the next 3 to 5 years, as much as 2/3 of all cardiac patients in the world would be in India. So is the sector growing? Yes. Is it concerning? Is it concerning for all of us? Yeah. I think that organizations like ours have to play a role in wellness as well. And we have to help the country become more healthy. And certainly that's a direction that we are headed in. So again, that's the good news, bad news piece. I think we have to deal with the disease burden that the country faces.